My name is Deanna Bruce. Let me know if you need me. And I'm the Director of Health and Wellness at DC Public Schools. And in my role, I oversee all of the school health programs and services and policies that come into DCPS. So partnering with our colleagues who bring us our school nurse program, partnering with our colleagues around immunizations, around our school-based health centers. We have in 5 of our schools that provide primary care services to students. And then also our supports, our sexual health supports in schools, including gonorrhea screenings, our condom programs, and then also our LGBTQ programs and a whole bunch of other stuff. And so specifically around our LGBTQ work, this came out of sort of some of our other health work. A few years ago, we were working specifically with our middle schools around sexual health capacity building. So we had identified a need in our middle schools to build sort of the competency of adults around students' sexuality. Because kids were experiencing sort of developmentally on track, sort of beginning to sort of have feelings for each other and experience things, and the staff didn't quite know how to handle it. And sometimes they didn't know whether it was to send them to the social worker for support or this, the assistant principal for discipline. We heard our staff was saying that they really desperately needed more support around across the spectrum for students. And as we began doing that work, staff kept telling us we actually really need more support around LGBTQ issues, and that they had to do their own needs assessment. Each school that engaged in this capacity building project with us had to do their own needs assessment, and LGBTQ supports was number 1 for just about every middle school that we worked with, whether it was making bathroom accommodations for students who requested it, or just helping staff be more culturally competent. That there was a big need. That was around the same time, sort of, so before I went here to DCPS, I was a lobbyist on HIV/AIDS issues and reproductive health issues. And so you always look for those moments, those opportunities that you have to sort of push through your agenda. Or not my agenda, but to push through, work that needed to occur. And so we had, building evidence that our schools were sort of begging us for more LGBTQ supports. At the same time, unfortunately, many students, young people around the country were getting a lot of press attention when they were taking their lives by suicide. And that gave us that opportunity. We also lost a DCPS student to suicide. And so we really just felt like, we couldn't wait a single moment to do something. So we immediately started convening listening sessions with our parents, with our students, social workers, principals, different listening sessions separately, but then also together. Sort of, what are the needs? What are we doing right? First of all, Andrew participated in some of these. What are we doing right? We've got to be doing some things right. And then where can we build from there? What are our assets and how do we build from that? And then what's needed? What are other supports? And through those listening sessions, we felt that we needed to pull the committee together. And so we formed our DCPS LGBTQ Advisory Committee, and Andrew and many other people, about 35 members, students, DCPS students, and principals, and school staff, and local experts, and national experts, all came together, and we worked over 4 months to look at the research, identify best practices from other schools. This poster we stole from San Francisco Unified School District. We designed this, we took their language from the bottom, and we also stole a liaison model from San Francisco Unified School District, where they invest in school staff who become sort of that ambassador at the school level to support other school staff and also students, and then we added families. As soon as we started doing our work with our advisory committee, it became clear that we couldn't talk about students by themselves without involving staff. And then really, students didn't exist because our staff are also gay, lesbian, bisexual, and transgender. So we also needed to support them in similar ways because we also heard from staff, I can't be out at work, I want to be able to put up my partner's picture on my desk, and I don't know if I can. and then it was complicated after the law. But, so, you know, we have to become staff, and then also after that, students don't exist in isolation, so how do we wrap families and support families, not only families of kids who are identifying as LGBTQ, but also parents who identify as LGBT. We have increasing numbers of students, of parents who are out in our schools, and they also want to feel welcomed and included as part of the school community. They want a variety of services, they want to be treated special, and they also want to be treated like everybody else. And so how do we make sure that the staff in the building, not recognized, appreciated for the diversity that they bring to their school community? So how do we build the supports in the school, on the school staff to be able to welcome all of our families from the moment they walk in the door and in their experience? And so that plan was developed in the spring of 2011, and a lot of, you know, really looking at the health angle of it. So, you know, if, you know, from my perspective and from the data, you know, if you're sitting in class worrying how you're going to safely get from one class to the other, how am I going to get my lunch? I have to get to the cafeteria. Maybe I need my teacher to go get my lunch for me, and then I don't have to go to the cafeteria, and I don't have to be harassed, and I can go back to my teacher's class and I get my lunch here. Right? That's a distraction from what the teacher's trying to do at the front of the class. And so, you know, when you're contemplating suicide, when you're engaging in risky sexual behavior because you're either trying to hide or you're trying to cope, that those don't contribute to your academics. And so how do we remove those barriers and make sure that kids are as comfortable in their skin as possible in our buildings so that they can fully engage in academics? And that really is the goal of our plan. And so we do that in a